Hey, this is Dr. Lenicky, final podcast of the year on aquatic exercise. Right, what is aquatic exercise? It's the use of water to facilitate the application of established therapeutic interventions, doing therapy in the water. When we think about aquatic exercise, we're not thinking about whirlpool or sitting in a hot tub. They're actually doing something to help with an impairment, such as increasing range of motion, increasing strength, um, performing or helping with neuromuscular control. All right, so what are some indications that aquatic therapy is appropriate? Well, if you're trying to facilitate range of motion, begin weight bearing. So remember, they're going to be in a limited weight bearing status in the pool when they're standing bilaterally, and we'll get into the specifics of that here in a few slides. We're doing some cardiovascular exercises. Aquatics are good for individuals who have such significant pain in their joints that they can't do anything aerobically on the ground with full gravity, but they can do it in an unweighted setting like the pool. You can also begin some resistance training and some functional activity replication. It does help with the delivery of manual therapy techniques and patient relaxation. There's some specific techniques you can use to help facilitate decreasing tone and relaxation in the pool. It provides a three-dimensional patient access. So if you're in the pool with the patient, you can still assist with any type of activity. And it helps to minimize the risk of injury or re-injury if used in an appropriate rehab setting. All right, what are some precautions? So these are not contraindications that I'm listing right now. I'm just listing precautions. So somebody has an extreme fear of the water. They may not be the best for aquatic exercise. You're going to have some patients that when they think of the pool, they're going to think about this shark here to the right instead of just thinking a fun thing. Another precaution is neurological disorders. Depending on the disorder, if they have a significant amount of ataxia where they can't walk normally, or they have difficulty controlling any kind of purposeful movement, it may be more difficult to help them control that while in the pool. Respiratory disorders. Because of the pressure of the water, you're going to have some difficulty with lung expansion. So you need to make sure the patient has sufficient lung function and can breathe easily in the water. Cardiac dysfunction is going to require some close monitoring. If the water is warm, a patient may overheat very easily when they have some cardiac dysfunction. And small open wounds and lines are a precaution as long as they are covered with a waterproof dressing. You never want anyone to get into a pool with an open wound that cannot be fully covered. All right, so when would we not want to get someone in the pool? So if they have unstable angina, they're having chest pain, you don't want to get them into a pool. If you think of what may happen if they have a cardiac event and they're in the pool, it's going to be more difficult to save them, to get them out of the water before you start CPR. Having a vital capacity less than 1 liter, again, the pressure on your lungs is significant. So if they already have a significantly limited vital capacity of their lungs, you don't want to put them in the pool. Right, severe peripheral vascular disease, if they have a bleeding disorder where they do not clot, and severe kidney disease. All of these are contraindications. Open wounds that can't be covered. So I talked about under precautions, as long as they can be covered with a waterproof dressing, they can get in the pool. If their wound is so large or it can't be covered with a waterproof dressing, you don't want them in the pool. The same with someone who is in incontinence. They do not have control of either their bowel or bladder. Or if someone is menstruating but they don't use internal protection. Anybody who has a water or airborne infection or disease, and uncontrolled seizures. So some of these precautions are to protect the patient from themselves. If they have a heart attack while in the pool, they're less likely to be able to get the help they need. Others are to protect other people and other patients who may get in the pool, such as the infections or bowel or bladder control. Right, so what are the properties of the water that make it so beneficial? So we're going to talk about several different properties and how we use these to both benefit the patient and unweight them, and we use it to create exercises to make them work hard. The first is buoyancy. This is the upward force that works opposite to gravity. So when you are in the water up to C7, so up to the base of your neck, only 10% of your body weight is on your feet. If that water level moves down to the xiphoid process, you have about 33% of your body weight on your feet. And at the ASIS, it's about 50%. So this can be used in individuals to unweight their joints. If somebody has such severe degeneration of their knees that you want to unweight them while they're exercising and put them in the pool, the deeper they go, the more you're going to unweight them. But this factor of buoyancy can also be used for exercises. Here's some pictures of some exercise equipment that use buoyancy. So these are foam items. So the dumbbell is a foam dumbbell. It will float. The thing that's around the patient on the left, that's an aqua jogger, and that is floating the patient completely off the ground. In addition, that patient has foam, I would call them footies, to create exercise. Now, for all of these, the force is going to be lifting up. So if I take that dumbbell and I push it deep into the pool, pushing down is the resistance. It's going to float to the top easy. So it's actually doing the opposite as if we had a dumbbell made of metal on the ground. We have to lift it up against gravity. Well, these are things that are floating because of the buoyancy. And so you push them down for resistance. Right, another property of water is hydrostatic pressure. So this is the amount of pressure that's exerted from the water on items that are in the water. So if you go into the water, you have pressure on you from the weight of the water in the pool. The deeper you go, the more pressure. So if you're only 6 inches deep, the pressure that's against you is all the water that is 6 inches or above. If you go down 4 feet deep, you have the water that is all of the 4 feet above you. And so this can help in many ways. It can help decrease swelling in the extremities. So there's going to be more pressure distally and less proximally. So it will help with that venous return. So it also helps to centralize any of that peripheral blood flow. Patients who have a condition called lymphedema they often see a lot of benefit from the pool because they can get in, walk around. The pressure distally helps to move that fluid more proximally, and they can have some control of their swelling. All right, the next property of water is viscosity. Viscosity is the friction that occurs between the molecules of a liquid, and this is what makes it hard to move something through the water. If you've ever been in a pool and tried to run quickly to the other side, it can be very difficult because you're having to push all of that water out of the way. The faster you go, the more resistance there is, and the bigger the surface area you have to move, the more resistance you're going to see. So when you're doing exercises, if you look at the picture on the left and the individual's moving their leg front to back, the slower that person moves, the easier it's going to be. If they want to try to make the resistance heavier or harder, they would move their extremity faster. Now, how do you make something bigger? So say we said earlier in the last slide, the bigger the surface that you're moving, the harder it's going to be. Well, you don't want to make your leg bigger to make it harder, but what can you do? These other two pictures show equipment that we can use, and the guy in the center has some gloves on that kind of web out, and the person on the right has little paddles, and we have some that we're going to use in lab that you can open or close to create a greater surface area. So moving an extremity that has a greater surface area by using this kind of equipment is one way to make an exercise harder. All right, another property of water, or property that you have to consider when you're putting a patient in the water, is their center of buoyancy. We talked about center of mass and center of gravity and maintaining balance in a standing position. That alters when you are in the pool and buoyancy comes into play. The center of buoyancy in most individuals is approximately the center of their sternum. So if you use resistance only on one side, you're going to cause rotation around that center. So you can rotate forward or backwards. So if a patient is doing an activity causing a rotation forward and their feet are not on the bottom of the pool, they may end up with their face in the water. Similarly, if they're using only one arm versus the other, they may actually rotate to the right or the left. When you have your feet on the bottom of the pool, the patient has two factors involved. They have their center of gravity and their center of buoyancy. So it does make balancing in a pool very different. And if a patient has never been in a pool before, or especially if they haven't been in a pool before and exercised, it can make it quite difficult. Another factor that you have to consider when working with patients in an aquatic setting is temperature regulation. So because they are immersed in water, they will have a difficult time sweating, or if they sweat, there's no evaporation to cool their body. You also, water will conduct temperature a lot faster than air. So if the pool is cold, it will chill them out or cool them much faster. Conversely, if the pool is very warm, they can overheat quickly. So you need to consider the temperature of the pool when doing different therapeutic activities. So if you're working on mobility, warmer may be better. If you're trying to gain functional control and do some neuromuscular reeducation, a slightly warmer temperature of the pool is better. But if you're doing aerobic conditioning, an individual is going to overheat quickly, especially if they're already compromised aerobically. And so if you're going to do any activity that gets a patient's heart rate up, you may want to consider having the patient in a cooler pool as opposed to a warmer pool. All right, you're going to see a huge variety of pools. From the one we have, the SwimX, where it can create a current. You can actually swim against it and have a treadmill in it. To the one here on the left, which is a traditional, what I would call a traditional therapeutic pool. Most therapeutic pools are going to have a way to get a patient into the pool who has limited mobility. So they may have a lift, they may have a ramp with they make wheelchairs that are water resistant, that you can put a patient into a chair and roll them into the pool. They typically have railings, they'll have different depths. So maybe begin at 3 to 4 feet, going to a deeper area. Some have railings within the pool, so kind of like parallel bars within the pool. They may have stairs, they may have ladders. And so you're going to see a good variety of that. The pool on the right is for an individual use. So the patient enters the pool, and the therapist can stand outside the pool, and often they fill the pool up for each individual patient. All right, what about the care and safety surrounding a pool? So Pseudomonas, and I'm not even aeruginosa, I may be pronouncing that completely wrong, but that's a very common bug, and it's an infection that can cause folliculitis, so inflammation of the hair follicles. It is frequently seen in pool settings, especially pool settings that have not been cleaned. So cleaning should occur at least twice weekly, checking the chlorine levels and the pH levels. Chlorine and pH levels should probably be checked daily or twice a day if possible. The surfaces around the pool need to be slip resistant. So water on a very smooth surface is going to lead to falls. If there are water splashes, you need to try to dry them immediately to prevent somebody walking by and falling. Having emergency procedures and safety rules and regulations is a must. You need to know what will happen in the event of a problem. So every pool I've worked in has either had a lifeguard on duty, or they've had a switch where you can, a switch that's on a string that goes to the edge of the pool. And if I pull that switch, it will call for the emergency response team within the hospital. So if you're in a pool by yourself with someone and they start to have a cardiac event or any other kind of emergency, you're going to need help. And so you need to have like safety rules and regulations and policies and procedures in place that can help you. Life preservers should be available, and everyone who puts someone in the pool should be CPR certified just in case. Often pools have spine boards to help get patients out in case something goes wrong. All right, thank you.